Our bodies rely on a delicate balance of strength and flexibility. For individuals with Ehlers-Danlos Syndrome, or EDS, this balance is disrupted, leading to a life often characterized by pain and uncertainty. EDS, a group of inherited connective tissue disorders, affects an estimated 1 in 5,000 people worldwide. Connective tissues provide support and structure to our skin, joints, blood vessels, and internal organs. In EDS, genetic mutations disrupt collagen, resulting in weakened connective tissues. Imagine a world where a simple hug could cause a dislocation, and where walking leaves you exhausted and in pain. The severity of EDS can vary widely, with some experiencing mild symptoms while others face life-altering complications. Despite its prevalence, EDS remains largely unknown to the general public and often misunderstood within the medical community. At the heart of Ehlers-Danlos syndrome lies a story written in the language of genes. In EDS, mutations within specific genes disrupt the production of collagen. These genetic mutations can be inherited from one or both parents, or arise spontaneously. The inheritance patterns of EDS vary depending on the specific type. For instance, hypermobile EDS often exhibits a dominant inheritance pattern. Understanding these patterns is crucial for genetic counseling and assessing the risk of passing on the condition. Not everyone who inherits an EDS-causing gene mutation will experience the same severity of symptoms. Factors such as environmental influences and lifestyle choices can influence the expression of the disorder. Ehlers-Danlos syndrome is a spectrum of genetic connective tissue disorders, each with its own unique set of characteristics. Currently, there are 13 recognized subtypes of EDS. While all types share the common thread of connective tissue weakness, they differ in severity. In affected tissues, hypermobile EDS is the most common, characterized by joint hypermobility, chronic pain, and joint instability. Vascular EDS, a rare but life-threatening subtype, affects large blood vessels, making them prone to rupture. Classical EDS features skin hyperextensibility and joint hypermobility. Kyphoscoliotic EDS affects bone development, leading to skeletal deformities. Understanding each EDS subtype is crucial for accurate diagnosis and effective management. Identifying the specific type is essential for proper treatment. Living with Ehlers-Danlos syndrome is like navigating a world where your body's own tissues conspire against you. The symptoms of EDS can range from mild joint laxity to life-threatening vascular complications. Joint hypermobility often leads to joint instability, dislocations, and chronic pain. Skin hyperextensibility manifests as fragile skin that bruises easily and tears with minimal trauma. These wounds often heal poorly, leaving behind atrophic scars. The digestive system can also be affected, leading to gastrointestinal issues like irritable bowel syndrome and gastroparesis. These digestive woes can lead to malnutrition and a diminished quality of life. For many, the journey with EDS is a relentless cycle of pain, fatigue, and uncertainty. For many of you, diagnosing Ehlers-Danlos syndrome can be a long and arduous journey. We understand how challenging this can be. EDS often masquerades as other conditions, making it difficult to pinpoint the exact cause of your symptoms. You're not alone in this. Your diagnosis will rely on a thorough clinical evaluation, a detailed review of your medical history, and the exclusion of other possible diagnoses. We're here to support you every step of the way. Clinicians use standardized criteria, such as the Baton score, to assess joint hypermobility, which is a key indicator. This process helps us understand your unique situation. While genetic testing is available for some EDS subtypes, it may not always be necessary or conclusive for your diagnosis. Remember, we're here to help you find the answers you need. Navigating EDS treatment requires a multidisciplinary approach. There is no cure for EDS. Treatment focuses on alleviating symptoms and improving quality of life. Physical therapy helps strengthen muscles and improve joint stability. Occupational therapy adapts the environment to accommodate unique needs. Pain management is essential, with options ranging from over-the-counter pain relievers to prescription medications. Hope flickers in the realm of Ehlers-Danlos syndrome, fueled by ongoing research. One promising avenue is developing targeted therapies that address genetic defects in EDS. Gene therapy holds potential to correct faulty collagen production, Researchers are exploring novel pain management strategies, such as non-opioid medications and nerve blocks. Understanding how EDS affects various organ systems can lead to targeted interventions. By gaining a better understanding of these systemic effects, researchers hope to improve overall health outcomes. Ongoing research continues to illuminate new pathways of understanding, paving the way for innovative treatments. The power of community emerges as a lifeline for those with Ehlers-Danlos Syndrome. Connecting with others who understand their journey can be transformative. Online support groups and social media platforms provide a space for sharing experiences and seeking advice. These communities offer a wealth of information and foster a sense of belonging. By sharing their stories, individuals with EDS challenge stigma and raise awareness. The future of Ehlers-Danlos Syndrome research shimmers with promise. Precision medicine tailors treatment to an individual's unique genetic makeup. Advancements in genetic testing allow for earlier and more accurate diagnoses. Gene editing, such as CRISPR-Cas9, offers hope for correcting faulty genes. Researchers aim to develop personalized treatment plans targeting the specific causes of EDS. The tireless dedication of researchers and patient advocates fuels hope for a brighter future. Ehlers-Danlos Syndrome presents a formidable challenge, but the human spirit shines through. Researchers, clinicians, and patient advocates are revealing new insights into EDS. Precision medicine and gene editing offer hope for effective management and mitigation of EDS's effects. The journey with EDS is marked by setbacks and the need for adaptation. The EDS community transforms isolation into empowerment and despair into hope. With each step forward, we inch closer to a world where EDS no longer defines the boundaries of what's possible.